Eric Amati coming to you live from the Face Family First Life Medicare studio. And I guess I'll use that term loosely since we're just here in my office. But anyway, I wanted to go over today because we've been getting a lot of questions about um, how does Medicare all work, right? So, how does original Medicare work? What does it cover? What does it not cover? What is Medicare Supplement? What's Medicare Advantage? How does it all work? What are the rules? How can I offer it? When can I offer it? Do I need any special certifications? All that kind of stuff. And so that's what I wanted to go through today is basically just kind of a Medicare 101 and also deep dive on Medigap, specifically Medicare Supplement, Medigap policies. So um, you can find a lot of this on our website. Again at fflmed.com / toolbox is all of our learning stuff. There's also a big link on the front of the page for Medicare 101 where you can cover some of this. I'll probably upload this into that training. But fflmed.com is our website where you can like get access to all this stuff. Okay. So, and if you have any questions about what you're watching, or want to ask me about specifically, feel free to email me, eric@fflmed.com, and I'll be more than happy to answer, whatever questions I get. So what we're going to cover first is just kind of a brief Medicare 101. Again, I know some of you guys know this, some of you guys don't. And so we're just going to cover it real fast. Okay. So what is Medicare? How does it work? What does it cover, not cover? What does it cost? What are the enrollment periods? Like we're coming into AEP right now. Everybody's talking about it, the annual enrollment period. What are the enrollment periods? What are the penalties if you don't get enrolled on time? And then what are the exposures once you have Medicare? Okay. So first of all, what is Medicare? So Medicare is a federal health insurance program. So it's, think Uncle Sam, right? It's put together by the government. It's for three types of people. Number one is people that are age 65 and older. Number two is people with certain disabilities. So if you're on Social Security disability, and also people with end-stage renal disease, kidney failure, basically, right? Those three types of people can get access to Medicare. Okay. There are two primary parts. Okay. Part A is hospital insurance. That's inpatient. That's that's going to the hospital, getting admitted to the hospital, right? And then part B is your medical insurance, outpatient. Okay. So that's the same thing. Like, if you have a health plan now, you go to doctor office, ENT, throat doctor, podiatrist, you name it, right? So hospital insurance, part A, medical insurance, part B. Part A and B together, that's original Medicare. Okay. When you sign up for Medicare, when you enroll in Medicare, you get a red, white, and blue Medicare card, just like this. Okay. And basically what that does is it's nationwide coverage. Okay. So there's no more networks, in network, out of network. There's none of that stuff, right? It's literally nationwide coverage. It's accepted by 99% of providers, and it works basically like an 80-20 plan. Okay. And that's a big oversimplification, but basically think like 80% is covered, 20% is not covered. Okay. So after you meet your deductibles, Medicare pays 80%, you pay 20%. The challenge is that 20% coinsurance is uncapped. Okay. Now, what that means in real life, I'm going to cover here in a minute, all the dollars and cents. But so what's covered under original Medicare? It's inpatient and outpatient services that are medically necessary. Okay. So, not your cosmetic stuff, no acupuncture, chiropractic, that kind of thing. And then also most dental care, eye exams, eyeglasses, hearing aids, and exams. They call those dental vision and hearing DVH. There's actually a separate type of add-on plan that you can get that would cover those things. But that's not covered by original Medicare. Okay. So how does Medicare work, right? What do you pay for? So part A, which is the hospitalization, most people receive part A for free. Okay. If you've worked 40 quarters, basically 10 years, you or your spouse, you paid Social Security taxes, then you get it for free. It's called an entitlement. You were entitled to it, right? If it's not free, you're going to pay somewhere between $274 or $499 a month based on how many quarters you paid into it. Okay. And then part B, most people pay $170 a month for part B. Okay. That is a premium that you must. But that's all taken care of through your Social Security. check, right? So I get paid by Social Security every month. So when I turn 65, I have a new source of income, Social Security. And then at the same time, they're going to deduct my Part B premium from my Social Security. Okay. And if I don't have Social Security, then they're just going to bill it quarterly out of my checking account or make me write a check for it, basically. Okay. So how do I get into Medicare? Okay. So to enroll in Medicare, you basically have a couple qualifying events. Okay. Number one is you turn 65. Number two is you've been receiving Social Security disability income for over 2 years. And number three is you are 65 and older. Maybe you're not in Medicare yet because you've been on group insurance, but now you leave or lose your group insurance. So that qualifies you to enroll. And then also, if you have end stage renal disease, kidney failure, you can also enroll in Medicare. Okay. There's two ways that you can get in. Okay. One is automatic enrollment. Number two is manual enrollment. Now, 99% of people are going to go through automatic enrollment. Okay. So we'll cover that first. The way it works is if you receive Social Security income, right, then 90 days prior to your 65th birthday, you're automatically enrolled in both Part A and B. Okay. And then you can choose to delay Part B if you have certain criteria. And I'll cover that for you in just a second. Okay. So manual enrollment is when you're not receiving Social Security income. So for some reason, you just don't qualify for Social Security income. In that case, you have to contact the Social Security Administration 90 days before the month of your 65th birthday, and you can choose to delay Part B. You enroll in Part A, and you can choose to delay Part B again if you have certain criteria. Okay. And so the way you contact Social Security is you can either do it by this telephone number, you can go to this website, or you can go physically down to your local Social Security office. Any way works just as well as the other. Okay. So when does Medicare start? Okay. For again, 99% of people, if you're not born on the first day of the month, right, then your birthday your Medicare starts on the first day of your birth month. Okay. So for me, I was born April 23rd. For those of you guys that want to remember and send me something, April 23rd. So because I was born April 23rd, when I turn 65, my Medicare will start April 1st. Okay. Now, for those of you that were born on the 1st, then your Medicare actually starts the 1st of the previous month. So you get like a bonus month in there, basically. Right. So lucky you. All right. Now, I kept saying before, like, if you delay Part B, why would you want to delay Part B? Basically, it saves you money, right? So Part B costs you $170 a month right now. And so if you can delay it, then those are several months. I don't have to pay that. So the way you delay it is, number one is you have to be working and in a creditable employer group plan. Okay. So for example, like, my wife and I'm on my wife's insurance through her job. Right. And so as long as I'm working and I'm on that plan, then I can delay my Part B. So Medicare Part A becomes primary, and then my employer plan becomes secondary. And that way, the Part B, Medicare Part B is duplicated. It's not necessary. I don't have to pay the $170 a month. Okay. But in order to delay it, right, you have to be covered by an employer group, and you have to be working. So you got to check with your employer. Do I have creditable coverage? That's the first question. Creditable coverage just means that Medicare says that, yes, this is just as good as having Medicare. So therefore we're cool with you having it. And then you have to do a cost comparison, right? Like just what does it cost for me to get on Medicare? What does it cost for me to stay on the group plan? And then you can enroll in Part B when your employment ends if you choose to stay on it. Okay. If you are not covered by employer group insurance, you can't delay Part B. You must enroll in Part B or pay your late enrollment penalty. Okay. So what is the penalty, right? How bad is this? What are we talking about? It's an additional 10%. So it's 1% a month up to 10% for every year not enrolled in Part B. Okay. So for example, let's say you delay for whatever reason for a couple of years, say 3 years, right? That's a 30% penalty. Okay. On your Part B. So the $170 a month that you were going to pay is now over $200 a month. And that's for the rest of your life. You can never get the ordinary rate. Okay. So you definitely, most seniors don't want to miss that penalty, that period, right? So the only way you can avoid that penalty is if you're already enrolled in an employer group plan and that employer group plan has creditable coverage. Okay. And COBRA is not creditable coverage, just FYI, right? So basically to kind of figure it out, you gotta look at, okay, what's the premium I'm paying for my employer plan versus what's the premium I would pay for Medicare? And then what are the deductibles? What are the coinsurance and copays? And what am I going to be paying out of pocket every year? Right. So the way to figure that out is here's the way it works with Medicare. Okay. So on Medicare, when you get your Medicare card and you go to the doctor, right? We'll do part A first. So if you're admitted into the hospital and I don't know what, the latest statistics are on what it costs to be in a hospital every day. I think it's somewhere between 11, 12, 15,000, something like that a day. Right. But for day 1 through 60 on Medicare, you'll pay $1,556 deductible. Okay. A one time. Okay. Whether it's 1 day or 15 days or 60 days, that's what you pay. Okay. Now, if you're in there longer than 60 days, starting on day 61, you'll pay $389 per day. Okay. For the next 30 days. And then after 90 days, if you're in the hospital at one time for longer than 90 days, you have a lifetime of another 60 days of reserve days at $778 per day that you pay. Okay. Now, after that, okay, for the next 365 days, you pay all costs. Okay. So, pretty large gap there for most people. And then for skilled nursing, okay, if you're in the hospital for days 1 through 20, you don't pay anything. After day 20, for the next 80 days, you pay $194.50 per day for skilled nurse. Okay. That's your costs, right? On part B, your costs are number one, there's a $233 annual deductible. Okay. And after you meet that deductible, every bill that you get from a doctor, an outpatient service, surgical service, durable medical equipment, whatever, is 20% coinsurance that you have to pay. And that 20% is uncapped, right? So that's why people get Medigap policies, right? So what are these Medigap policies? They're also known as Medicare Supplement. They help fill in the gaps in original Medicare, and they're sold by private insurance companies, okay? So best way to choose a Medigap policy, and if you don't have one of these, I suggest you pick it up. It's you can go to medicare.gov, download this. This is the 2022 version, but they have a 2023 version out now. And it's like soup to nuts, everything you need to know about Medigap policies. It's a great resource. A lot of the information in these slides were pulled directly from this. Okay. So what we're going to do going over this Medigap deep dive here is basically what is a Medigap policy? How does it work? What does it cover? What are standardized plans? What are non-standard states? What are the plan comparisons? What's a plan F? What's a plan G? We're going to go through all that. Okay. And we're also going to talk about the macro legislation. We're going to talk about how you're becoming eligible to enroll, what it's like when you're turning 65 versus replacing, what guaranteed issued scenarios are, underwriting basics, and just basically building your portfolio if this is something that you want to like add to. Okay. Add to the way you do business. So WTF is a Medigap policy, right? So it's basically a Medicare supplement plan. Okay. It's supplemental insurance sold by private insurance companies designed to cover all of those gaps that we just talked about in Medicare. Okay. So the way it works is it goes with your Medicare card. So when you go, again, nationwide coverage, 99% of doctors, if they take Medicare, they take your Medicare supplement. Okay. Period. And it works like an 80-20 plan. So after deductibles are met, right? Medicare pays 80%, you pay 20% as coinsurance, or instead of you paying the 20% coinsurance, the Medigap policy pays it for you. Okay. So that's why they're super popular. That's why people love them. Okay. So the other things people love about the Medigap policies is number one, it's portable. So it doesn't matter where you are in the country. Okay. If you go, if you live in Kansas and you have a Kansas Medigap policy, doesn't matter. It works in California, it works in Florida, it works in New York, doesn't matter. Okay. The doctor bills Medicare. The doctor could care less what Medicare supplement you have. So they don't care whether it's Aetna, Cigna, United Healthcare, or, literally like some company you never heard of, right? And there's a lot of companies you've never heard of that have Medigap policies, right? The doctor does not care. The doctor bills Medicare. Medicare pays what Medicare pays, and whatever Medicare does not pay, they bill your Medicare supplement company. It's that simple, and it's really seamless, right? So it's whatever the client's going to come out of pocket depends on the plan that they have. And so we're going to go through that in detail here. Okay. So what does a Medicare supplement or Medigap policy cover? Okay. Number one, it covers inpatient services, part A. It covers outpatient services, part B. things that are medically necessary, right? And it does not cover dental, vision, health, hearing. It doesn't cover chiropractic. It doesn't cover cosmetics. If Medicare does not cover it, the supplement doesn't cover it. Real simple, right? So, it literally, like, whatever Medicare pays, the Medicare supplement pays what Medicare does not pay for that, if that makes sense, right? So you don't have you don't have to learn a bunch of like extra benefits. It's just whatever Medicare pays for, the supplement pays for the difference, right? So, um, it's portable, which I already said. It's guaranteed renewable by CMS. That's the Center for Medicare Services. That's Uncle Sam, right? Once you're in it, as long as you pay your premium every month, they cannot cancel it on you. Okay, which is awesome, right? It can only be canceled by the person paying the premium. And they also can't be singled out for a rate increase, meaning like if they get really sick, it doesn't matter. Their rates aren't going to go up. They're protected. It's group insurance. They're protected by the whole class that they're in, right? And also the Medigap plans and the benefits are all standardized. Okay. So a plan G sold by Aetna is going to be the same as a plan G sold by Medico, a plan G sold by Prosperity, a plan G sold by Mutual of Omaha, a plan G sold by United Healthcare. What makes them the plan is not the insurance company, it's plan G, right? So the benefits are all standardized. The only real difference is really price. It's literally like, going to the grocery store and looking at milk, right? And organic milk, for example, pasteurized, whatever it is. And this gallon of milk is, 350 and this gallon of milk is 750. I mean, there's really no reason to pay the extra $4, right? So it's the same thing with Medicare supplement, right? So this is literally ripped right out of that book, okay? And this is what I like show all clients, like if they're because this is the number one thing a lot of clients just don't get, seniors. And so if you get this one thing, it's really kind of like a light bulb, right? So this is their language, right? The government. All Medigap policies must follow federal and state laws designed to protect the senior, and policies must be clearly identified as Medicare supplement insurance. Medigap policies are standardized, and in most states are named by letters, plans A through N. Each standardized Medigap policy under the same plan letter must offer the same basic benefits no matter which insurance company sells it, which means that cost is usually the only difference between Medigap policies with the same plan letter sold by different companies. Once that light bulb goes off for people, that's what creates the opportunity for us as insurance agents to save them money. Because a lot of times people just think, oh, I'm on Aetna, for example, and I love Aetna because when I went through cancer last year, or whatever the case may be, right? When I went to the doctor, they paid for it's not Aetna that paid for everything. It's the fact that you were on a plan G or a plan N or whatever, right? That's what made it pay for everything. Not Aetna being so great, even though Aetna is great, right? Hopefully that makes sense for everybody, right? So if I can move somebody from this plan G to this plan G and save them $20, $30, $50 a month, that's real money that goes in their pockets that helps improve their standard of living, and they don't lose anything. So it's wish I could drop this mic right there, but hopefully that makes sense to you guys. Anyway, that's why also this slide, like just if you pull this out and save it, for your client, like this is right out of the handbook and it's about as plain English as you can get. Okay. So now let's go through what these plans are. Okay. So again, when I was talking about original Medicare, we were talking about part A, B, C, and D, right? Those are parts of the Medicare law. These plans, they also have alphabet letters after them, right? So it's kind of confusing. People are like, I don't understand. Part A and B, original Medicare. Okay. C and D, these are all parts of the Medicare law. Okay. Plans A through N, right? Those are supplement plans to take care of what original Medicare doesn't pay for. Okay. That's what the difference is. Okay. Now, in most states, plans A, B, C, D, F, G, K, L, M, and N are the plan letters that you're going to have available. Okay. Plans F and G, they have high deductible options available in some states. So this is kind of cool. So for people that want to have a little bit more skin in the game, don't mind having, say, a $2,500 deductible, right? They can save quite a bit of money going on a high deductible, plan F or plan G, right? So, and then in Massachusetts, Minnesota, Wisconsin offer other standardized options. I think it's Minnesota actually you actually pick what benefits you want. It's kind of like Legos. You make your own supplement, which is kind of neat. But nationwide, right? We're going to keep this real simple. Nationwide's plan F, G, and N are the most common. Okay. So we're going to go through those in detail. All right. So this right here is basically out of the handbook. It goes through A, B, all the different plans and what they pay. So if you look right straight down column F, right in the middle, you can see it covers the most, right? And then on either side of it, you can see which things are covered and which things are not covered based on this grid. Okay. Here's another grid, okay, which literally is the same information, but this is actually from an insurance carrier that we lifted for this presentation. So by law, the insurance companies that offer Medigap, they have to include this entire grid, okay? Whether they sell it or not, they have to include the whole thing to educate the seniors, okay? So with this particular carrier, you can see that columns A and then G and then N and F, those are shaded. That means that those are the only plans that they offer. Okay. So even though they don't offer B and C and E and L and M, they have to include it because by law they have to include it. Okay. So, and you can also see on this one, they moved plans C and F over to the side. The reason for that is because plans C and F are no longer available for people newly coming into Medicare. Okay. They have to have been eligible for Medicare before 2020 in order to be able to buy C and F. Okay, that's why they're separated. And that law is actually called MACRA. So let's talk about that for a minute. So MACRA is the Medicare Access and Chip Reauthorization Act. Okay, and what it did was it basically created two classes of Medicare recipients. Okay, so the first class are people that were eligible for Part A. So what determines which class you're in is when you were eligible for Part A. If you were eligible for Part A prior to January 1st of 2020, then you have access to all the plans. Okay. If you're eligible after 2020, after January 1st, 2020, so all of 2020, 2021, 2022, now 2023 coming up, right? Those people, you can no longer get plan C or F. Okay. But as long as you were eligible before 2020, you can still get C or F today, even for the first time, if you wanted to switch into it. Right. So if you were once eligible, you're always eligible. So they're not taking away anything from anybody who had it. They're just saying for new people coming in, those plans aren't available. Okay. So it's really important to understand there's two pools of Medicare beneficiaries because of this MACRA law. Okay. So let's talk about Plan F first. Okay. So Plan F, again, you have to have been eligible for Plan A before 2020 started in order to be able to buy this. Okay. But Plan F, what it does is you can see basically on the left, it says, here are the different benefits for hospitalization. Okay. And this is just looking at hospitalization. You can see Medicare pays all but $1,560, right? And then you can see Plan F pays for $1,560. Therefore, you pay zero, right? That's what this column say, right? And you can see here's what Medicare pays, and then the middle what Plan F pays, and therefore what you pay. Now, the reason this plan so popular is because on the right, you can see you pay zero all the way down the board, right? Same thing on Part B. So medical expenses, right? Here's what Medicare pays. Here's what Plan F pays. Therefore, you pay nothing. So again, no copays, no deductibles. Whatever Medicare does not pay, Plan F picks up. Okay. So what I understand is the reason that they discontinued this is because people were just, abusing it. And so they wanted to have a little bit of skin in the game. That's why they discontinued it, right? So again, the people that can get Plan F are people that were eligible for Part A prior to January of 2020. Okay. It's first dollar coverage, which means like literally from the very first time you get a bill, it kicks in. You pay the premium and nothing else, right? Which is again, like it's the Cadillac of plans, right? So now most new Plan F blocks, right? People that are coming into Plan F, let's say they're leaving a Medicare Advantage plan or they're switching from a Plan A to a Plan F because they, now they're going to the doctor more. They want to switch. They're going to be underwritten. we'll talk about that in a little bit. But because of that, um, they're projecting that these have a lot more steadier rates, going into the future, right? And so, but we'll talk about that when we get into the guaranteed issue regulations and everything. So now let's talk about Plan G. Okay. So Plan G is literally the exact same as Plan F with one difference. And that is that each year, okay, so on Plan A, it's the same. Okay. Same 100% on everything. The only difference is that on Part B, right, there's a $233 annual deductible. Okay. So that's it. Okay. And you pay that, you don't pay it all at once. You basically pay it like as you're going to the doctor. So if you go to the doctor and let's say your bill is $100, again, Medicare pays 80%, you pay 20%, which is $20, right? You can go to the doctor a lot of times before you hit $233, right? But once you hit that $233, Plan G picks up everything. Okay. So same thing. And so why Plan G? Why do people want to get this? So number one is it's lower premium than Plan F. Okay. So because of that skin in the game, you save some money, right? The Part B deductible is the only additional cost. The funny thing about it is that the savings that a senior gets from switching from a Plan F to a Plan G, when you map it out over the course of the year, they're probably going to save some money on Plan G a lot of times. Also, historically lower rate trends than Plan F, because there is that deductible, people are just a little bit more mindful of how they use it. So if they're not, think about premiums this way, right? Every year your premium can go up. Okay. So in the state of Texas, for example, premium can go up, right? And it usually does go up because medical costs get more expensive every year, right? But the reason that plans go up is because people are using them, right? So anything that you put in the plan to cause people to think twice before they use it causes the premium to be more stable, right? Why does that matter to you as an agent? Well, because if the premium, if somebody gets a premium increase, that makes them start thinking, oh, should I shop around, right? If their premium is not increasing very much, then they don't really have to think about it. Their premium just stays on autopilot most of the time for most of us, if you think about it, right? So that's why that's important. So it's a lower rate trend than Plan F. As long as you're, going to the doctor, like around 8 times or more, right? That's usually when we recommend a Plan G. Okay. If they're not going to the doctor at least 8 times or more annually, they might get a better deal on Plan N. So we'll talk about that in a minute. So let's talk about Plan N. Okay. So Plan N, again, same exact thing on the hospitalization, right? So Part A hospitalization, it's the same, whether you're Plan F, Plan G, or Plan N, all exactly the same, right? They pay whatever Medicare does not pay. Okay. And then on Part B, right, medical expenses, doctor offices, they have that same $233 deductible. Okay. Part B deductible. And then after the deductible is met, pardon me, there's a $20 copay every time you go to the doctor. And there's a $50 copay every time you go to the emergency room, unless you're admitted to the hospital. Okay. So for example, if you slice your hand, go to the emergency room, that's a $50 copay. If you are having chest pains, you go to the emergency room and then they admit you because, oh my goodness, you're having a heart attack, then no $50 deductible, right? Or copay. So that's the way Plan N works. Okay. And then the other thing is Part B excess charges. So you can see kind of, I don't know if you can see my mouse, but like the third line down says Part B excess charges above Medicare approved amounts. So on Plan F and G, they pay those. Okay. On Plan N, you pay those. An excess charge is basically by let's say a doctor is like, okay, well the Medicare approved rate is X, right? And the doctor says, well, man, that's just not enough for me. So they have the right to bill up to an additional 15% over what Medicare pays, and then that's called excess charges, right? So most of the time, most doctors don't do this, but there are a few doctors that do. And so when they do Plan N, that's on you. You pay that. Okay. And we can talk a little bit about that in a minute, but the why Plan N, okay, is it's a substantially lower premium than F or G. So it's about 30 to 35% lower than Plan F. It's about 15 to 20% lower than Plan G in most states. It's still 100% Part A coverage. Okay. Hospitalization. There's very minimal Part B copayments. 97% of doctors accept Medicare assignment, which is what Medicare says the rate should be, 97%, right? So 99% accept Medicare, and of those, 97% of those accept Medicare assignment. The ones that don't, they're the ones that charge the excess charges, right? So you just have to check and see before recommending a plan in, does their doctor do Medicare assignment? If they do, no problem. If they don't, then you got to just figure out how many procedures are they actually having there, right? So if you're the type of person that has infrequent doctor visits, you ask somebody, hey, how many times do you go to the doctor? Oh, I go twice a year and for my flu shot. Plan N, right? If you talk to somebody and they're like, oh, I go every month, plus I have 3 different procedures okay, well, maybe then Plan G makes more sense, right? So, and also on Plan N, it's the lowest rate trends in the industry. So just like before, we were talking about rates staying steady. Plan N are the steadiest rates that you're going to get. And also some of the highest commissions that you're going to get in per state. That's to encourage agents to show these, okay? Because the premiums are lower, so sometimes agents have a premium bias because we get paid percentages in Medicare Supplement, right? So the more the premium is, the more commission you make. So sometimes agents in the past were overlooking Plan N because it was cheaper, and so most carriers have caught on to that. They pay a higher commission to level it out, right? So that agents are more likely to now show Plan N. I personally love Plan N. I think Plan N is probably the best deal for most people, just being overly generalistic, right? So now let's talk about eligibility, okay, for Medicare Supplement. So number one, to get a Medicare Supplement plan, you must have Medicare Parts A and B, okay? And then there's an open enrollment period, which is the first 6 months that you have Part B, okay? So when you get your Medicare card, it says Part B for me will be April 1st of whatever that year is, right? And for the next 6 months of getting on Part B or turning 65, I can sign up for guaranteed issue for Medicare Supplement, okay? And that's my right. I'm entitled to it. It doesn't matter which plan I want. They have to give it to me. It doesn't matter what's going on health-wise, guaranteed issue, okay? So and the open enrollment also for Medicare Supplement is not like your regular open enrollment for ACA or Medicare Advantage, this AEP stuff. It's literally just the first 6 months of getting on Part B or from turning 65 with Part B, okay? Pick any plan you want. No underwriting, can't be denied. Boom, right? Now, outside of open enrollment, okay, 365 days a year, and this is where it gets kind of exciting, okay, for insurance agents, right? If you go through a simplified issue, which is yes or no, it's very similar to like a final expense plan, right? They can switch from one Medicare supplement to another. Okay. So, and why would they do this? Again, because every Plan N is the same as every other Plan N, regardless of which carrier sells it, because Plan N does what Plan N does, period. Right. So, used to be there was a pass fail. So you go through underwriting and it was like, yep, nope, kind of like America, but now they have tiered underwriting with a lot of carriers. So preferred, standard, substandard. So there's, sometimes there's a drug screen. Sometimes you go through a phone interview, you can be denied, right? So it's not like guaranteed issue, but you can access it all year long, right? So each carrier can come up with their own underwriting rules. That's fine. So you want to look up what the carrier you're looking for, what the declinable conditions are, the drugs that they don't want to see. And by the way, all this is handled for you inside CSG Actuarial. So we went over Medicare Center and how to quote through Medicare Center and CSG. If you use those tools and plug in whatever their conditions are, the drugs that they're on, CSG will tell you, oh, okay, use this one, not that one. So, but most of the time they're looking for major conditions in the last 2 to 5 years. Okay. Also, they're looking for things to just watch out for if they're confined in a wheelchair, right? Any kind of confinement, they're bringing around an oxygen tank. If they're on insulin, a lot of times they can get through underwriting, but like if they're carrying around a big EpiPen or something, it might be a little harder. Pacemakers are a problem. Cancer, heart, stroke, not good. Some of them are cancer ever, for example. Narcotics, any kind of nervous disorders like Lou Gehrig's disease, Parkinson's, that kind of thing, MS, dementia, rehab, even physical rehab. Those are all things that are consideration when they go through underwriting. Okay. But just to keep it simple, think, okay, if I get this person qualified for day one coverage, final expense, there's probably a carrier out there that I can get them covered for with MedSup. Okay. Now, so there's open enrollment, there's going through underwriting, and then there's guaranteed issue. Okay. So this confused me a little bit when I was first learning it, but guaranteed issue and open enrollment, even though it's the same result, okay, it's not the same. Okay. So, because if you apply somebody for initial enrollment, open enrollment, and you check guaranteed issue, you're making a mistake on the app. Okay. So open enrollment is when you're first getting into Medicare. Okay. You are guaranteed to have coverage, right? During open enrollment. Guaranteed issue period is the same results. Okay. It's just not the same. So what this is driven by is when you lose coverage. So when you have an involuntary loss of coverage. So for example, your group coverage that you're on, you get laid off, fired, you quit, whatever the case may be, right? If your MAPD, your Medicare Advantage prescription drug plan, let's say it stops operating in your state, right? Also, your Medicare supplement plan. You may be on a Medicare supplement plan and it may, go out of business. Like they may decide Aetna may not want to offer plan F in that state anymore, for example. Okay. So every year, I think the statistics are every year, 1 million people get kicked off of their plan involuntarily. Okay. And what that does is it creates a guaranteed issue situation. So not to worry, right? There's plenty of other companies out there that want your business. So there's 63 days. You have a guaranteed issue right. Okay. Some states even allow voluntary termination of group, right? So like if I just decide to quit my job, I can get on guaranteed issue, right? The one interesting thing is that moving from one state to another does not create guaranteed issue rights. So like even under Medicare Advantage, when I move, that I am guaranteed I can get on a new plan somewhere else because Medicare Advantage is a health plan. But because Medicare is portable, right, all over the country, it doesn't really matter. So if I live in Kansas and all of a sudden I move to California, there's no difference. Again, the doctor doesn't care what Medicare supplement I have, right? So now the carrier may figure it out and decide they want to change your rates or whatever, but there's no guaranteed issue, right? Okay. So, and then there's some variations by state, and these you just kind of have to look up based on where you're selling. So like, for example, Connecticut, Massachusetts, Maine, and New York are all guaranteed issue states. That means anytime you want, all year long, guaranteed issue, you can switch whenever you want. Okay. And while it sounds really nice, it also means the rates in those states are a lot higher, right? Because carriers can't control for health, right? State of Washington is guaranteed issue on plan A only, but you can switch plan A anytime you want. In Missouri, you have guaranteed issue on your policy anniversary. So if I bought my policy in January, right? Every January, I'm guaranteed issue, right? In California, Idaho, Illinois, Nevada, Oregon, they have birthday rule states. So birthday rule just means that, so I was born in April, every year in April, guaranteed issue, I can switch, right? Which is kind of nifty. So all those states are a little different. You're just not going to get paid. Now, when you write a guaranteed issue plan, you're not going to get paid the same as when you write a underwritten plan, right? Because the carrier, again, can't control for variables. Carriers guaranteed issue, they have to abide by guaranteed issue, but like if every carrier had their way, there wouldn't be any guaranteed issue, right? They would check everybody out. So let's talk about selling Medicare Medigap plans. So as an agent, right? So one way to sell them is to people who are new to Medicare, people that are turning 65, called T65 for short, right? That's a longer sale because you have to educate people on Medicare, right? So I've been talking here for 39 minutes, right? I'm going through it pretty quickly because I know you guys, it's recorded, you can go back. But imagine sitting down here and kind of educating a senior, right? So it takes a little bit longer. You have to have a little bit more patience. You want to answer a little bit more questions, et cetera. The positive, though, is that it's 100% placement on business because there is absolutely no underwriting at all, right? Which is awesome. So you're never going to be in a situation where the person doesn't get covered. You explain it to them, you help them choose, they get covered, you get paid every time, right? There's higher cross-marketing opportunities because when they're first getting in, they probably need a supplement, they probably want a DVH plan, they probably want a prescription drug plan. They probably might want to get a cancer policy or a heart policy, depending on their past history, right? An ancillary. A lot of cross-marketing opportunities at the point of sale when somebody's turning 65, right? Plus, they're leaving their company. Maybe they need to roll over a 401k into an annuity. I mean, there's all kinds of things. Somebody's turning 65, exiting the corporate world and getting onto Medicare, the transitional things that you can help with, which is awesome. And it's also a higher lifetime value of the client because you're gonna earn your commissions month after month after month after month, right? And the lifetime value on most of these clients could be, everywhere from 12 to 15 to $1,800, $2,000 lifetime value, depending on how long you keep your clients with you, and how well you stay in communication with them, right? So now on replacements, so those people turning 65, right? Replacements is anybody they've already turned 65, they already have Medicare supplement. Now you're going to replace, right? So now what replacements, you don't have a lot of education because they've already been educated, right? You're literally just selling on premium savings. You're going to be able to save them $15, $20, $30, $50, whatever it is, right? If you can save them money and they can understand that the changing companies does not mean changing benefits, right? Plan G is Plan G is Plan G. Then it's a shorter sale, less education needed. Okay, that's positive. But underwriting is required now. So not everybody who applies is going to get in, but we're kind of used to that on the life insurance side of things anyway. Also, it's higher premiums. Okay, so higher premiums means higher commissions, right? And it's excellent persistency because once you've been underwritten, you've gotten in a plan, chances are, I mean, you're never going to be younger and healthier than you are today. It's something we've all been saying for a long time. So once they get in, I mean, they may not be able to switch in a couple of years, right? So it's excellent persistency on replacement business, right? So those are the two markets, turning 65 and then replacements, right? So now let's talk about just marketing and compliance, right? So Medigap does not fall under the Part C marketing guidelines, the AHIP marketing guidelines that you've all been reading about, okay? So the same restrictions that exist to sell, say, final expense is the same restrictions for Medigap, Medicare Supplement. Okay. You can cold call to sell Medigap. You can door knock to sell Medigap, except in Ohio, right? You can cross sell anything with Medigap. So if somebody buys Medigap, they can also buy life insurance. They can also buy a cancer policy. They can buy whatever they want, right? You do not need a scope of appointment to sell Medigap, and you do not need a certification to sell Medigap. All you need is your health license. Okay. And I sent an email out actually recently to a lot of agents and just reminding them, hey, if you have a health license, you should probably get certified, get appointed with this because you don't need any special certifications for it. Okay. Now you don't need every Medigap product that's out there. Okay. So with Family First, what's really cool is you already have more than likely access to 3 right now and may not even know it. So Mutual of Omaha has an amazing Medicare supplement product. It is the number 2 most purchased Medicare supplement product in the country. And you probably already have it. If not, just ask your upline. They'll set you up with it. Number 2 is Americo. Americo has a Medicare supplement policy. And number 3 is Aetna. So Aetna, most of us are appointed with Aetna final expense, already have Aetna Medicare supplement. Now, the thing with those 3 is we have them already. You don't have to do anything extra. Just use your writing number and go crazy, right? But we also have a bunch of other Medicare supplement carriers. I think there's an additional 9 that we went through and researched and found and run through Elder Care, okay, which is a Family First Life's Medicare partner. So the reason that you want the Elder Care appointments is because Elder Care appointments come with all the extra integrity tools, right? So the Medicare Center, the CSG actuarial quoting tool, again, free, the CRM, the call recording software, all that stuff. All you need is one appointment with one Medicare supplement Medigap carrier through the Elder Care side of things, and you get all that stuff. Okay. And again, that's all at fflmed.com. If you go to fflmed.com and click contracting, then you actually just fill out that form right there, and you can get access to those carriers. Okay. Some of your uplines already have them, and some don't. So if you're in a group that doesn't, hit this link. If you're in a group that does, ask your contracting admin and they can get them for you. But those are the carriers like Medico, USIC, MAC, Manhattan, United, Humana, Cigna, and there's a couple others that I'm forgetting right now. So excellent products. Oh, we're also going to have ACE, which is, I think, the lowest priced carrier in almost 40 states. So it's like we're just getting that one right now. So anyways, you don't need every Medigap product. Just get 5 carriers or so that you run with regularly, right? So 1 or 2 flagships, which we already have, right? And then 1 rate warrior, which is the lowest rate in whatever state you're selling in. And you can discover what's the lowest rate in your state by using the T65 app. So T65.app, if you're already contracted with one of our carriers, you can get into that for free. And if you're not, and if you're not sure, go to this and try to sign in with your NPN. Okay. If you can sign in, you're good. If you can't sign in, hit us up. Again, go to fflmed.com/contracting and we'll get you set up. Right. And then 1 or 2 with wiggle room or niches, right? That are maybe they're a little bit easier on people with diabetes or whatever. Right. And then you can just add or replace carriers as needed as you grow your business. So it's a really, what I've noticed after incorporating it in my business is there's just a lot more credibility and a lot more, trust, right? When the people that you're talking to know that you understand this, especially in the senior market. If you can talk intelligently about this, if you can help them change their coverage, if you can help them get coverage in place, if they have a friend who's struggling with deadlines and all this kind of stuff, you understand it, the value that you bring to that person, just because it's absolutely necessary. Like they can't not deal with it, it's not an option. They have to take care of it by law. And so as a result, if you're the person that knows how to help them with it, it makes a massive, massive difference for them. And it'll help your referral game, helps your persistency game, helps all of that stuff on the life side as well. So anyway, I hope this was helpful for all you guys. Again, if you want to reach out to me, my email is eric@fflmed.com. Our website, fflmed.com. And anything I can do to help you get up and running, incorporate this into your business, help you help some clients, I'm happy to do so. So thanks again for your time.